the President of Ghana, His Excellency John Dramani Mahama, the President, West African College of Surgeons, Professor Ibrahim Ademuya Kasai, MNI, the Honorable Minister of Health of Ghana, Honorable Kwabena Minta Akando, members of the Executive Committee of the West African College of Surgeons, past presidents and members of councils of the West African College of Surgeons, this 24th Sir Samuel Manuel Lecturer, Professor Hannah Faal, the Chairman, Local Organizing Committee, Second Vice President, Professor Afua Ehese, Honorary Fellows of the West African College of Surgeons, Director Generals of the West African Health Organization, Presidents and Representatives of International Colleges, representatives of the West African College of Surgeons partner organizations, Director Generals and Chief Medical Directors, members of the Diplomatic Corps, my Lord, spiritual and temporal, distinguished fellows of the West African College of Surgeons, members of the press, distinguished ladies and gentlemen, good morning. On behalf of the President, members of the Executive Committee, past President, Council, and the entire body of the West African College of Surgeons, it is my pleasure to welcome all of you to Accra, the pride of the Republic of Ghana. We are happy that you are able to attend this 66th annual conference of the West African College of Surgeons. This is the 10th time this conference is taking place in Ghana. The last one was in 2014 when it took place in Kumasi. Thank you. Mr. President, sir, permit me to invite the chairman of the local organizing committee, Professor Afua Hesse, the second vice president, to deliver her welcome address. Thank you.
Good morning, everyone. His Excellency, the President of Ghana, John Dramani Mahama, the President of the West African College of Surgeons, Professor Ibrahim Yakasai, the Honorable Minister for Health, Honorable Minta Akando, members of the Executive Committee of West African College of Surgeons, past presidents, members of council of the West African College of Surgeons, the 24th Sir Samuel Manuel Lecturer, Professor Hannah Faal, honorary fellows of the West African College of Surgeons, the honorable members of Parliament here present, distinguished representatives from the University of Ghana and its colleges, presidents and representatives of international colleges, representatives of West African College of Surgeons partner organizations, Director Generals and Chief Medical Directors and Medical Superintendents here present, distinguished heads of parastatals here present, members of the Diplomatic Corps, Nime and Name, distinguished fellows, members and diplomats of the West African College of Surgeons, members of the press, distinguished ladies and gentlemen. Akwaba, you say yeah. I bid you a warm welcome to the opening ceremony of the 66th Annual Conference of the West African College of Surgeons being held in this prestigious venue, the Ohene Konedu Complex of the University of Professional Studies, UPSC, in Isig, Legon, Accra. The last time the conference was held in Accra, as we were mentioned earlier, was in 2014, 12 years ago. And I'd like to thank His Excellency the President for honoring our invitation. It is true that contacting you was not easy, sir. Your commitments are so many, and you are very well protected. But thank God, the wax arms of surgeons does reach wide, and many fellows have been involved in getting us where we are today. We remember with nostalgia our past teachers and surgical leaders in Ghana who are now part of the cloud of witnesses which encompass us. The late Professors E.A. Bedu, J.K. Kwate, E.Q. Achampong, E.D. Yeboah, Professor Sir Dr. Reku Brobe, Professor Rudolph Darko. They taught us well, and the good they gave us, we will continue to carry along. I need to especially thank all the members of the LOC and all the members of the various subcommittees. And I'd like to ask those who are in the hall to please stand up and be acknowledged. Those who helped us get this conference going, please stand up. Thank you very much. When we took on this task, we didn't realize the enormity of the task. We have learned so many lessons along the way. I've particularly learned the importance of being precise when you're writing letters, especially to politicians and academicians, because one may not find it so easy to get a second chance to explain. So thank you, His Excellency the President, for being here despite your busy schedule. We are grateful. And I thank all in FSH, which is Flagstaff House, who worked to make this possible. Honorable Minister, thank you so much for your support, especially for the outreach. We thank our hosts, the Vice Chancellor, Professor Kweku Mensah Mawuto of UPSA, for being such a strong collaborator. We would not have done this without you. Honorable Titus Bayo, Honorable Parliamentarian for Lamprisi, thank you so much for all your assistance. He is a fellow of Sangaini, and thank you. So, to all our few corporate sponsors that answered our call, we thank you. A warm welcome to all fellows from West African countries to our annual gathering. Both local, our partners, both local and international. Last week, we held the pre-conference outreach. It was hugely successful by the grace of God. And some of the lesions that were operated on were very huge. Hernias, neck swellings, which spoke to the healthcare disparities that are evident across the country, and which such interventions as the outreach seek to address. Mr. President, 855 Ghanaian patients had smiles restored on their faces last week after the surgical procedures, which were free of charge to them. They all remain well and will be followed up by the local teams. A huge thank you to the 26 international volunteers and 65 local volunteers who gave up their time, energy, and resources to this endeavor. Please, are there any of the volunteers in the meeting? Can you please stand up so we can acknowledge you? Mr. President, we still have bills to pay, so we would like to be able to come back to you. And we also want to make it a yearly affair, so it's not just once in 14 years, but more regularly, so that more of our people who are outside can access the excellence that this college represents. Thank you, sir. The next few days are going to be an exciting mix of scientific, educational knowledge, training, and honing of clinical skills with colleagues from the same faculty. There'll be occasions for networking and renewal of acquaintances and practicing our multilingual skills and learning new words and phrases. Before I conclude, I'd like to acknowledge the following for their kind and extraordinary assistance to us in preparing this welcome for all our delegates. The Office of the President, especially Dr. Callistus, his Secretary to the President, the Chief of Staff, the Office of the Vice President, the Minister for Health, the IGP, the Director General Immigration, the Ghana Revenue Authority, the Vice Chancellor of UPSC. Their assistance has been so helpful. We are truly grateful. Do find time to visit Ghana properly and savor the sights and sounds of our beautiful country, just as we will regale you with our Ghanaian delicacies. And yes, there is no context. Ghanaian jollof wins. Thank you, PWAX. I am done.
Thank you very much, Chairman of the Local Organizing Committee. Mr. President, sir, with your permission, we will have a 5-minute cultural performance. Thank you. Thank you very much for the great performance. It is my pleasure to recognize the presence of the Honorable Deputy Minister of Health, Dr. Grace Ayensa Dankwa, you are welcome, ma'am. It is also my pleasure to recognize the presence of our sister college officials. I will start with the chairman of the Ghana College of Physicians and Surgeons. You are welcome. The president, Ghana College of Physicians and Surgeons. You are welcome. Director, Ghana College of Physicians and Surgeons. You are welcome. The Provost, College of Health Sciences, University of Ghana. You are welcome. The President of the West African College of Physicians. You are welcome. The Secretary General of the West African College of Physicians. You are welcome. The President, West African Postgraduate College of Pharmacy. You are welcome. The Secretary General, West African College of Nursing and Midwifery. You are welcome. The Executive Secretary, West African College of Nursing and Midwifery. You are welcome. The President of the National Postgraduate Medical College of Nigeria. You are welcome. And the Registrar, Professor Temitope Ayodeji Esan. You are welcome. It is my pleasure to invite the officials of the sister colleges to give us a very physicians. Thank you.
Thank you very much. Your Excellency, Mr. President of the Republic of Ghana, Your Excellency John Dramani Mahama, Your Excellency Minister of Health of the Republic of Ghana, Mr. President of the West African College of Surgeons, Honorable Past President, members of the Diplomatic Corps, and staff of the West African College of Physicians, to the leadership and members of the West African College of Surgeons. I sincerely thank you for inviting us to the 66th annual I wish you fruitful discussions, practical outcomes, and partnership that will continue well beyond that meeting. Thank you, and I wish you a very successful conference. Long live the sister colleges. Thank you very much.
Thank you, sir. It is my pleasure and honor to recognize the presence of Professor Tim Mitchell, Royal College of Surgeons, England. You are welcome. The Royal College of Surgeons of England delegation, you are all welcome. Dr. Henry Ford, past president of the American College of Surgeons and honorary fellow of WACS. You are welcome, sir. Professor John Mulba, Liberian College of Physicians and Surgeons. You are welcome, sir. Representative of the Royal College of Surgeons of East and Central Africa, COSEXA. You are welcome. So we now continue with the goodwill messages of about 1 minute. 1 minute. Thank you. Thank you very much. So, Royal College of Surgeons of England, thank you.
Thank you. Your Excellency, President of the Republic of Ghana, Honourable Minister for Health, the President, Vice Presidents, Executive Committee, Council and Fellows of the West African College of Surgeons, colleagues, ladies and gentlemen. First of all, I'd like to thank the President and Executive Committee and Council of the West African College of Surgeons for this very kind invitation to join you here. And it's a great pleasure for me to be here in West Africa and specifically in Ghana. This reflects the fact that the relationship between the West African College of Surgeons and the Royal College of Surgeons of England is very important to us, and I'm delighted to be accompanied by Dorothy Kufeji, one of our council members, and Bill Thomas, former Vice President of the College, and other representatives of our college in London. I look forward to a stimulating conference with the opportunity to discuss ways to increase our collaboration and to strengthen that relationship. And I bring with me the very best wishes from the Council and the members of the Royal College of Surgeons of England and the surgical community across the United Kingdom. Thank you very much.
Thank you very much, sir. It is my pleasure and honor to recognize the presence of the Registrar, Medical and Dental Council of Nigeria, Professor Fatima Kari. You are welcome, ma'am. I also want to acknowledge Professor Ernest York, President of the Ghana Medical Association. You are welcome. So we continue with the 1 minute goodwill message. President of the West African Postgraduate College of Pharmacy. Those who understand English should indicate. Thank you.
Thank you. The President, the Republic of Ghana, the President West African College of Surgeons. Please permit me to stand on the well-established protocols. I am the Secretary General of the West African Postgraduate College of Pharmacists, and on behalf of the President of our college, I extend warm greetings and heartfelt goodwill to the fellows of the West African College of Surgeons on this occasion of your annual scientific conference. We commend the West African College of Surgeons for the timely and forward-looking theme, capacity building in surgery, developing the next generation of surgeons in West Africa, which speaks directly to the urgent need for sustainable human capital development in our regions. The future of surgical care in West Africa depends not only on technical excellence, but also on deliberate investment in training, mentorship, research, and institutional strengthening. We are particularly encouraged by the sub-team focusing on artificial intelligence in surgery and leveraging on technology and innovation in surgical procedures. This reflects a shared vision for modern healthcare delivery, one that embraces digital transformation, data-driven decision-making, precision medicine, and interdisciplinary collaboration to improve patients' outcome. We therefore reaffirm our commitment to collaboration with the West African College of Surgeons in advancing education, innovation, and excellence in healthcare practice across the sub-region. Wish you a fruitful annual scientific conference and continued impact in shaping the future.
Thank you, sir. Professor, representative of the Royal College of Physicians of Surgeons of Canada, Dr. Yvonne. President, West African College of Nursing and Midwifery. President, National Postgraduate Medical College of Nigeria.
Your Excellency, the President of the Republic of Ghana, I want to stand on the existing protocol. I read this speech on behalf of the President, National Postgraduate Medical College of Nigeria. I am the college registrar. I bring you warm greetings from the National Postgraduate Medical College of Nigeria. I extend my sincere congratulations to the West African College of Surgeons on the successful convening of its 66th annual scientific conference. Annual scientific conferences remain indispensable to professional and academic institutions. They provide critical platforms for intellectual engagement, peer review, interdisciplinary collaboration, and the dissemination of cutting-edge research and innovation. The National Postgraduate Medical College of Nigeria highly values its long-standing relationship with West African College of Surgeons, our shared commitments to excellence in postgraduate medical education, specialist training, research, and ethical medical practice provide a strong foundation for deeper collaboration. We remain willing and ready to partner with your esteemed college in strategic areas including training harmonization, faculty development, curriculum innovation, research collaboration, capacity building, all aimed at strengthening our mandates and improving healthcare outcomes for our people. I will have greatly desired to be personally present at this important conference and to formally convey my goodwill in person. I will also have welcomed the opportunity to invite you to my investiture ceremony scheduled for Friday, 6th of March 2026, as the 24th President of the National Postgraduate Medical College of Nigeria. Unfortunately, pressing exigencies of office have made this impossible. In conclusion, please accept my heartfelt congratulations to the leadership, fellows, and entire membership of West African College of Surgeons on this successful conference. I wish you productive deliberations, meaningful engagements, and outcomes that will further advance surgical care, training, research in our sub-region. Congratulations.
Thank you, sir. The President of the Liberian College of Physicians and Surgeons.
His Excellency, the President of Ghana, fellows, members, and partners, on behalf of the Council, faculty, and residents of the Liberian College of Physicians and Surgeons, we extend our warmest fraternal greetings to the West African College of Surgeons on the occasion of its 66th annual scientific conference in this vibrant. Our presence here in Accra is more than a professional visit. It is a homecoming. The relationship between the medical communities of Liberia and Ghana is rooted in a shared history of resilience and mutual growth. From the inception of Liberian College of Physicians and Surgeons, we look to the Ghana College as a blueprint for our residency program. Ghana has not just hosted our trainees and provided expert external examiners, but has continuously served as a beacon of academic excellence and a steadfast neighbor of our program. As we deliberate onto the theme, capacity building in surgery, we reaffirm our commitment to this collective mission. We wish all the delegates a productive and inspiring conference. Long live WACS, long live LCPS, long live the friendship between Ghana and Liberia. Thank you.
Thank you, sir. Secretary General of the College of Surgeons of East and Central Africa, COSEXA.
Your Excellency, the President of the Republic of Ghana, President of WACS, past Presidents of WACS, distinguished leadership of the West African College of Surgeons, esteemed fellows, candidates, and colleagues. On the behalf of the President and the fellows of the College of Surgeons of East, Central, and Southern Africa, I bring warm fraternal greetings and heartfelt congratulations on the occasion of the 66th Annual Conference of WACS. 66 conferences represent 6 decades of commitment to excellence and service to West Africa and beyond, and we salute WACS for this enduring leadership. To the exam candidates of this year, we wish success in your examinations, and to the graduating fellows who are coming on Thursday, congratulations. You are at the brink of joining the ranks of African surgical leaders. And to all WACS fellows, we wish you continued health, strength, and success in your noble calling. Together WACS and COSEXA represent more than 30 African nations and nearly 850 million Africans. Our shared responsibilities are immense and our missions are closely aligned. We're building capacity, strengthening training systems, and elevating surgical care standards across our regions. Hence, I would like to convey the COSEXA Council's strong wish to further strengthen the close partnerships between our two sister colleges. Standing in the beautiful land of the Republic of Ghana, we're reminded of the President Kwame Nkrumah's words. Divided, we are weak. Unified, Africa could become one of the greatest forces for good in the world. In this spirit, let us remember that our futures and meaningful strength lies in our unity. Thank you, and long live the West African College of Surgeons.
Thank you, sir. It is my pleasure to recognize the presence of Professor Patricia Turner, Executive Director, American College of Surgeons, and Professor Girma Terfera, Director, American College of Surgeons, Hope. You are all welcome. Thank you very much. Finally, just 1 minute of goodwill message from the Chairman of the Ghana College of Physicians and Surgeons. Or the President? Okay, good. Go ahead. Thank you. Go ahead, sir. Ma. Okay, you're welcome, sir. Thank you. Okay, Joseph.
Very brief, yes. I'll be very brief. Your Excellency, the President of the Republic, I would like to stand by the protocol so ably established by the previous speakers and simply say, ladies and gentlemen, proud fellows of West African College, let me first thank the President and Council of the West African College of Surgeons, Professor Akasi, as well as the Chair of the Local Organization Committee for inviting me as a special guest at the Annual General Scientific Meeting. To the graduates, congratulations. I wish you many years of fulfilling service to your respective nations. I first had a look at your theme, capacity building in surgery, and sub-themes, innovations in surgery and leveraging technology in surgical training. And I nearly had a heart attack because these are the very topics that we have either addressed at our just ended Annual General Scientific Meeting or plan to deliver at an upcoming public lecture. Great minds think alike, they say. And I look forward to sharing the results of our efforts with yours. This is indeed the way to go. We live in a world of paradox. In one part of the world, things that were scientific fiction just 2 decades ago are now top-notch technologies. Whereas, on the other part, people lack access to essential services. We can all exceed it if we use innovation and relentless collaboration. Let's look at our younger generation. They should consider mastering leapfrogging technology. I remember the mobile phone was designed as an instrument to replace the landline in the north, but in the south, it is the bank and it is your doctor. We also must tread very carefully in the current multipolar winds of change. What we lack is relentless collaboration and resilience innovations. Does it really matter whether we move to the east or move to the right, so long as we move forward? I thank you very much. God bless. Thank you.
Thank you. Thank you very much, sir. Mr. President, sir, permit me to invite the Honorable Minister of Health, Ghana, Honorable Kwabena Minta Akando, to deliver his address. Thank you. You are welcome, sir.
Your Excellency, the President of the Republic of Ghana, President John Dramani Mahama, the President of the West Africa College of Surgeons, members of the Executive Council and Fellows of the College, presidents and representatives of sister postgraduate colleges, Director General of the West African Health Organization, our revered religious leaders present, heads of health agencies, teaching hospitals, universities, and training institutions present, distinguished guests, fellows, members, and trainees of the college, ladies and gentlemen, it is a privilege to address this opening ceremony of the 66th Annual Conference and Annual General Meeting of the West African College of Surgeons at a gathering that brings together some of the most accomplished surgical minds in our sub-region, alongside partners and institutions that shape the future of specialist care across Africa and beyond. Before I address the substance of our deliberations, allow me to place this conference in its proper context. We meet today not merely as professionals exchanging ideas, but as custodians of essential pillar of health systems. Surgery is not a luxury add-on to healthcare. It is a core service without which maternal health, trauma care, cancer care, emergency response, and basic human dignity cannot be protected. It is therefore fitting that Ghana hosts this meeting, and it is equally fitting that the team focuses on capacity building. The next generation of surgeons, anesthetists, theater teams, and allied professionals will determine whether our countries can close the gap between what our people need and what our systems are currently able to provide. Distinguished guests, the West African College of Surgeons has more than 6 decades proving that regional institutions can produce global standards. WACS has not simply trained specialists, it has built a professional culture. Excellence must not be limited to a few centers, but should be expanded across borders and across communities. This is why I congratulate the college on its 66th anniversary. It is an achievement measured not only in years, but in lives saved, disability prevented, and futures restored. Ladies and gentlemen, let me now address the substance of why we have gathered. Across our sub-region, the demand of our surgical care is rising. Urbanization, road traffic injuries, non-communicable diseases, obstetric emergencies, and the changing burden of disease have combined to increase the need for timely, safe, and affordable surgery. Yet, in too many places, surgical care remains constrained by factors that are not clinical alone, but systemic. The question before us is therefore not simply how to produce more surgeons. The question is whether We will build a system that allows skill to translate in safety and knowledge to translate into access. Permit me to highlight 4 priority areas that must shape our regional agenda. First, readiness for safe surgery must be treated as a system requirement. In many facilities, the difference between successful surgery and preventable harm is determined by readiness. Sterilization systems, oxygen reliability, diagnostics turnaround time, theater functionality, intensive care support, blood availability, supply chains, and infection prevention protocols are not secondary conditions. They are the infrastructure of safety. Ghana's approach is to strengthen readiness through combination of investment and operational discipline so that facilities are not only built but are functional, staffed, supplied, and governed to standards. In this respect, WACS remain an essential partner in accreditation, standard setting, and safeguarding of training platforms. Second, training must expand, but supervision and quality must expand with it. Capacity building requires numbers, but it also requires quality. It requires structured mentorship, clear supervision arrangements, competence-based assessment, and consistent clinical governance. The next generation of surgeons must not only be trained, but train well and train safely. This is why collaboration between WACS, national colleges, universities, and teaching hospitals matters. It's also why deliberate measures are needed to strengthen inclusion, particularly to improve gender balance in surgical training and leadership, and to ensure that talent is enabled to thrive. Third, affordability remains one of the strongest determinants of outcomes. Across our countries, the clinical pathway is often defeated by the financial pathway. Patients delay care because they cannot pay. Families litigate assets, communities resort to public appeals, conditions worsen until interventions become more complex, more expensive, and more risky. Health financing must therefore protect patients whilst enabling facilities to deliver quality specialist services. In Ghana, we are advancing complementary measures that speak to prevention, protection, and specialist support. We are scaling out the quality-focused free primary healthcare initiative to strengthen early detection and referral. We are strengthening the financial base and predictability of the National Health Insurance Scheme. We are also implementing the Ghana Medical Trust Fund, popularly known as Mahama Cares, named after my president, to support catastrophic costs for priority chronic conditions, including cancers, chronic kidney disease, and cardiovascular disease, among others. Because sustainable financing must be linked to workforce outcomes. And because treatment capacity without human capacity is not sustainable. Fourth one, innovation must be translated into routine practice. This conference's attention to artificial intelligence in surgery and innovation in surgical education is welcome. But innovation must not remain on conference agenda. It must enter training curricula, governance framework, and service delivery pathways in ways that improve safety, improve decision-making, and expand learning. Research, audits, and quality improvement must be strengthened across our region. We need multi-center collaboration that produce locally relevant evidence, and we need systems that convert evidence into better outcomes. Distinguished guests, we must also speak candidly about the retention challenge. The migration of skilled professionals has become a defining pressure on health systems in West Africa. Retention requires working conditions that match expectations, career pathway that reward excellence, continuous professional development, and supportive environment for practice. At the same time, diaspora engagement must become more structured through visiting faculty arrangements, remote mentorship, and targeted partnerships that strengthen institutions. Allow me at this point to acknowledge a practical demonstration of service that has accompanied this conference: the surgical outreach undertaken over the past week, resulting in 855 surgeries across 11 hospitals in 6 regions, clearly reflects what professional solidarity can achieve when expertise is mobilized for communities. Ghana is grateful, and we acknowledge the contributions of local and international volunteers who made this possible. And I'm told some of you want to come back to Ghana to work here. You are welcome. Ladies and gentlemen, I will conclude with 3 practical expectations for our deliberations. First, that we strengthen regional collaboration in training and accreditation so that standards remain high and training opportunities expand across borders. Second, that we commit to system readiness as a baseline for safe surgery, recognizing that theaters, oxygen, blood diagnostics, referral pathways, and clinical governance must be strengthened as an integrated whole. Third, that we pursue financial pathways that protect patients and grow capacity and link investment to measurable service and workforce outcomes. The evidence is clear. The need is urgent. The professional capacity in this room is immense. What remains is the collective decision to act and the discipline to implement. Your Excellency, the President of the Republic of Ghana, ladies and gentlemen, the Ministry of Health assures WACS of our support for the priorities and innovations that will emerge from the conference. I congratulate the local organizing committee for their work, and I wish all delegates productive deliberations and successful conference. To our visiting delegates, I welcome you warmly to Ghana. I encourage you to experience our hospitality, culture, and heritage as your schedule allows. And don't forget to get your smokes or fugus along with you. Long live the West African College of Surgeons. Long live our West African Partnership in Health. And I thank you for the opportunity.
Thank you very much, sir, for the great work you are doing and for the continuous support. It is my pleasure to invite the Secretary General of the West African College of Surgeons, Professor Fred Ogumba, to invite the President of the West African College of Surgeons to make his remark. Thank you, sir. You are welcome.
Your Excellency, President of the Republic of Ghana, John Dramani Mahama, with your kind permission, may I invite the President of the West African College of Surgeons, Professor Ibrahim Yakasai, to deliver his address. President, sir.
When you are sitting next to the president, there is a lot of palpitations ongoing. And therefore, my president is with a smaller p, this time only. Your Excellency, President Mahama, President of the Republic of Ghana, the Minister of Health, Honorable Akondo, members of the Executive Committee of the West African College of Surgeons, past presidents, and members of the West African College of Surgeons, Chairman LOC, 24th Samuel Mona Lecturer, Professor Fall, Honorary Fellows of the West African College of Surgeons, President, Secretary General, Registrar, and Rector of Sister Colleges, President and the Representative of International Colleges, Representative of Partner Organization of the West African College of Surgeons, Registrar, Medical and Dental Council of Nigeria, past President ACS, Vice Chancellors, Rectors, Director General, and CMDs, members of the Diplomatic Corps, my Lord Spirituals and Temporal, distinguished fellow of the West African College of Surgeons, members of press, distinguished ladies and gentlemen. It is with great pleasure I welcome you to the 66th Annual Scientific Conference of the West African College of Surgeons, hosted in the great city of Accra in Ghana, holding between 8 to 12 February 2026. This conference provides a vital platform of knowledge sharing, collaboration, and innovation in surgical care. I appreciate His Excellency, the President of Ghana, for accepting to be the grand patron of this conference, and the Minister of Health for supporting the local organizing committee. I further congratulate Mr. President over his success in the last election, and we have visibly seen his achievements since arrival in this country. This conference started with pre-conference activities. Notable among them is the leadership training of council members by a collaborative effort between the American College of Surgeons and the West African College of Surgeons. I wish to also highlight the progress on our college property in Ghana, where our office building is at advanced stage. We seek the support to finalize this project, and I believe the President will be invaluable in achieving this milestone. The theme of this year's conference is capacity building in surgery, highlights our commitment to adapting to technological advancement and leveraging innovation in surgical practice. The outreach group, as you have heard much earlier, have done over 850 surgical operations, ranging from fibroid, in my specialty, cataract, hernia, and many more. I thank our Ghanaian fellows for hosting this event, and they encourage all participants to engage fully and shape the future of surgery in West Africa. Your Excellency, at WAGS we are proud to stand in solidarity with you. We firmly believe that collaboration across health professions is essential to advancing the region's healthcare outcomes. Together we can drive meaningful change and force solutions to the unique challenges facing our health system. We look forward to exploring synergies, deepening interprofessional collaboration during and beyond this conference. Let us continue to build the bridges, break silos, work hand in hand towards a future where quality, accessible healthcare is a reality for all West Africans. Past presidents of the West African College of Surgeons, members of the council, fellows, members, diploma of the college, president of sister colleges, past president of the American College of Surgeons, representative of the Royal College of Emergency Medicine, all our partners in program, ladies and gentlemen. This conference promises 4 days of excitement, knowledge sharing, partnership, and forging new relationships. We hope you will make time to enjoy the sights and sounds of Ghana. Thank you very much. Mr. President, sir.
Thank you very much, sir. It is okay. Okay, you will invite him. Okay. Good morning, all. It is my pleasure to invite the President of the West African College of Surgeons, Professor Ibrahim Adamuyakase, to invite His Excellency, the President of Ghana, for investiture as Grand Patron of the 66th Annual Conference of the West African College of Surgeons. You are welcome, sir.
May I invite Her Excellency, to deliver his address. Okay. That's fine. So go. Okay. Mr. President, please go. ATC. Look at it. Thank you for the investiture, for accepting to be our grand patron. As we're doing the dressing, you can see that this should go down. Yes. Thank you. And well dressed. I hope the heart is not going to be. That's perfect, sir. Your Excellency, this was from the West African College of Surgeons, presented to you this day as our grand patron.
Thank you.
I also present this certificate that will be hung in your parlor or somewhere within the palace there.
Thank you very much, Mr. President of the West African College of Surgeons and Chairman of the occasion, the Honorable Ministers of State, distinguished leaders of the West African College of Surgeons and sister colleges, representatives of the West African Health Organization, health agencies, universities and training institutions, members of the diplomatic corps, religious and traditional leaders, distinguished guests, fellows, members, and trainees of the college, ladies and gentlemen, people actually deserve to be a fellow of surgeons. There's this tradition where increasingly when your wife is giving birth, you are invited to attend on the birth. The surgeon takes a knife and starts cutting her stomach and run out of the operating theater. So I wonder whether I really deserve this gown I'm wearing. And let me commend you for the profession that you have chosen. You've saved many lives, and may God richly bless you. It's a great honor and privilege for me to join you at the opening ceremony of the West African College of Surgeons' 66th Annual Conference. On behalf of the people and government of Ghana, I wish to warmly welcome all delegates from across West Africa, from the wider African continent, and from other parts of the world. Ghana is pleased to have you and to host this important gathering. When the college last convened in Ghana in 2014, I had the privilege of participating as head of state. Today, as we gather here in Accra, this conference addresses a professional community that transcends national borders. It reflects our shared regional aspirations and the enduring partnerships we continue to build with colleagues and institutions across the world. Mr. President of the College, I'm deeply grateful for the honor you've conferred on me by naming me as Grand Patron of this conference and admitting me as an Honorary Fellow of this distinguished. These recognitions on behalf of all the people of Ghana with humility and renewed commitment to support the work of the College, because the work of surgeons is expressed my deepest appreciation to the volunteer surgeons who used your professional skill to put the smiles on the faces of my countrymen and women across the country. As was mentioned, there's an outstanding bill, and I've discussed with the Minister of Health, and you kindly submit the bill to the Minister of Health. We will take up. We will take up that cost and still express appreciation to you for what you have done. Ladies and gentlemen of the West African College of Surgeons, the West African College of Surgeons exemplifies what our sub-region can achieve when professionalism, shared standards, and a common purpose guides our efforts. As an institution affiliated with the West African Health Organization, the college embodies the spirit of regional cooperation that our ECOWAS community must continue to strengthen. Over the decades, WACS has trained and produced a significant proportion of the surgeons serving across our countries. For this enduring contribution, I convey the appreciation of governments and people across our entire sub-region. It is fitting to acknowledge the pioneers whose vision laid the foundation of this great institution, including Dr. Victor Anoma Ngu and Sir Samuel Manua. Their foresight continues to benefit generations of specialists and countless patients they serve. As a host nation, Ghana is proud of the contributions made by Ghanaian surgeons and teachers to the college's growth and specialist training across West Africa. We recall with profound respect the late Professors Emmanuel Augustus Bedu, Emmanuel Kwe Achampong, Edward Kofi Donko Yeboah, George Rekubrobe, and John Kwateboy Mamon Kwati, among many other eminent West African pioneers whose scholarship and mentorship strengthened surgical training and service across our sub-region. Their legacy reminds us that progress in healthcare is built on discipline, mentorship, and service, and that behind every institutional milestone are individuals who paid a personal price so that others may live, learn, and thrive. Today, I recall with solemn respect Professor John Kwateboy Mamon Kwate, who together with his two younger colleagues, Dr. Isaac Bensi and Dr. Benjamin Osaiviafi, tragically lost their lives while returning from a surgical outreach program in Sunyani. Their sacrifice remains a powerful reminder of our collective duty to build systems in which access to specialized care is not determined by geography and where quality of service are available to every community. The theme of this conference, capacity building in surgery, is both timely and compelling. Capacity building must be understood comprehensively. It is not only about producing more surgeons, it's equally about strengthening the teams and the systems that support safe surgery, including anesthesia, nursing, diagnostics, blood services, sterile supply chains, critical care, and reliable referral pathways. It also requires robust clinical governance, continuous professional development, and regulatory frameworks that protect patients while enabling skilled practice. The government remains committed to strengthening these foundations We will carefully study the recommendations coming out of this conference and work with stakeholders to implement those that require immediate action while developing structured pathways for longer-term reforms. We also recognize the need to expand and upgrade health infrastructure across our countries in the sub-region. At the same time, we must be realistic about fiscal constraints many health systems in our sub-region face. This calls for sustainable and innovative financing and service delivery models, including responsible private sector participation that safeguards equity, quality, and affordability. Governments working with professional bodies and training institutions must explore practical mechanisms to support newly trained health professionals in establishing viable services, particularly in underserved and unserved communities, while ensuring appropriate oversight and adherence to standards. Not only a matter of fairness, but also a practical necessity for stronger, more resilient health systems. I therefore encourage the College to maintain deliberate measures that promote female participation across all surgical disciplines through mentorship, supportive institutional policies, and training structures that enable excellence alongside family responsibilities. The future of capacity building will also depend on how effectively we harness innovation. I'm encouraged by the College's embrace of information and communication technology in training and examinations. Conference sub-themes such as artificial intelligence in surgery, innovation in surgical education, and the application of technology in clinical practice reflects the direction of modern medicine. When deployed responsibly, technology can strengthen education, improve clinical decision-making, facilitate mentoring, and enhance quality assurance. Research. Evidence-based practice is indispensable to clinical excellence and sound policy. This conference provides a valuable platform for professional networking and international collaboration that can strengthen research capacity, mobilize resources, and accelerate the translation of evidence into better clinical outcomes. Mr. President, ladies and gentlemen, we must also confront the renewed migration of our skilled health professionals, which is placing increasing pressure on our health systems across our countries. Our response must be deliberate and practical, improving working conditions, strengthening career pathways, enhancing professional recognition, and creating environments in which health workers can thrive and choose to serve, while also developing structured avenues to engage the expertise of professionals in the diaspora. Universal access to quality health care remains central to our country's development aspirations. Financial risk protection is essential to ensure that illnesses do not lead to avoidable hardship for families. That's why in Ghana we're implementing the Ghana Medical Trust Fund that the Minister just spoke about as a key pillar of our national response to non-communicable diseases. The fund supports treatment for priority conditions including cancers, chronic kidney disease, and cardiovascular diseases, conditions that impose heavy clinical and financial burdens on families and health systems alike. Crucially, the fund is also structured to strengthen the supply of specialist care. Beyond financing treatment, a defined portion of the resources in this fund are allocated to training specialist doctors. In doing so, we're not only responding to today's needs, but also deliberately investing in the specialist workforce required for timely, safe, and high-quality care in the years ahead. Specialist training does not advance in isolation. It advances through common standards, shared facilities, accredited training platforms, and sustained regional cooperation. We will therefore continue to look to the West African College of Surgeons, its national chapters, and its accredited institutions as strategic partners in shaping specialist training, strengthening quality assurance, and building a resilient surgical workforce in our country and across our sub-region. In surgical care, timely access is critical. Trauma, obstetric emergencies, cancers, congenital conditions, and acute surgical illnesses require prompt and safe interventions. When access is delayed, preventable disability rises and avoidable deaths occur, and families endure needless suffering, and this underscores the importance of your work and your advocacy. Distinguished guests, I commend the West African College of Surgeons for its unwavering commitment to excellence in training, standards, and service. As you deliberate, I encourage you to consider solutions that can be scaled across our diverse health systems, strengthening equity and access across our countries. While your engagements will be intense, I trust you will also experience Ghana's warmth and hospitality and enjoy the richness of our culture. Mr. President of the College and distinguished guests, it is my singular honor to declare the 66th Annual Conference of the West African College of Surgeons officially open. May God bless Ghana. May God bless the West African College of Surgeons. Thank you very much.
Your Excellency, thank you very much for the visionary leadership. May God continue to guide and empower you and strengthen you. Pictures? Okay. We have already talked to the Minister of Health. We'll do the honorary award. It is my pleasure to invite the honorary fellow, Professor Abubakar Adamu Rashid, MNI, to stand. Professor Abubakar Adamu Rashid is a highly distinguished Nigerian academic and an administrator whose career spans extensive leadership and educational contributions. He was born in 1958. He is a professor of English studies. He obtained his PhD in English, specializing in stylistics from Ahmadu Bello University, Zaria, in the year 1991. He also holds a Master of Arts in English Language with distinction from the University of Nottingham, England, and an earlier Master of Arts in English Literature and a Bachelor of Arts, upper second class honors from the Bayero University, Kano. Additionally, he is an alumnus of the National Institute for Policy and Strategic Studies. His academic journey at Bayero University, Kano saw him progress to Professor of English Studies by the year 2001. He held numerous pivotal roles within the university, including head of department, dean of the Faculty of Arts, deputy vice chancellor for both administration and academics, before ascending to the vice chancellor and chief executive officer position from the year 2010 to 2015. Beyond his direct university roles, Professor Rashid's impact is significant at the national and international levels. He served as the Executive Secretary of the National University Commission of Nigeria from 2016 to 2023, a critical role overseeing the country's entire university system. His leadership extended to roles such as Pro-Chancellor and Chairman of the Sule Lamido University and President of the Oxenia University Network in the UK. Earlier in his career, he was also Managing Director and Chief Executive Officer of the New Nigerian Newspapers Limited. He also contributed as a judge for the Nigerian Literature Prize. Academically, his areas of expertise include stylistics, discourse analysis, and systemic grammar, and he has supervised a considerable number of undergraduate and postgraduate students. He has an extensive publication record, including academic books and numerous peer-reviewed articles. Notably, Professor Rashid has made significant contribution to medical education in Nigeria, leading curriculum reviews advocating for dedicated medical universities, and facilitating the advancement of medical professionals into leadership positions. Professor Retsid's career exemplifies profound commitment to scholarship, educational reform, and administrative excellence across Nigeria's higher education sector. Mr. President, sir, I have the great honor to present to you Professor Abubakar Rashid Emanai, so that you can confer on him the Honorary Fellowship of the West African College of Surgeons. Okay, sir.
With the authorities conferred on me by the Council and the approval of Fellows of the West African College of Surgeons, I confer on you the Honorary Fellowship of the West African College of Surgeons. Thank you.
May I invite the Honorary Fellow, Professor Sanjay Krishnaswamy, to stand, please. Professor Krishnaswamy is a distinguished leader in pediatric surgery, currently serving as the Surgeon-in-Chief at Doembacha Children's Hospital and Professor of Surgery and Pediatrics at Oregon Health and Science University. He earned his undergraduate degree with summa cum laude honors from De Quisne University and his medical degree from the Temple University School of Medicine, where he was inducted into the Alpha Omega Alpha. Professor Krishnaswamy completed extensive surgical training, including a general surgery residency and a pediatrics surgery fellowship, and is board certified in both general and pediatric surgery by the American Board of Surgery. At Oregon Health and Science University since 2005, he has held significant academic and administrative roles, including Vice Chair of Surgical Quality and Operations and Program Director for the Pediatric Surgery Fellowship, which received an ACGME commendation. Globally, Dr. Krishnaswamy is a recognized authority, having served as the inaugural president of the Association of Academic Global Surgery and chair of the Global Pediatric Surgery Committee for the American Pediatric Surgical Association. He co-founded the Global Health Advocate Program in Surgery and has been pivotal in advancing global surgical education and initiatives. His commitment to teaching is evidenced by multiple faculty teaching awards and dedicated mentorship of trainees. Finally, Dr. Krishnaswamy's scholarly contributions are extensive, comprising numerous peer-reviewed publications, 2 book editorships on academic global surgery, and 16 books chapters. He holds editorial positions for the Journal of Surgical Research and SCORE. He is a frequent invited lecturer nationally and internationally and has been recognized as a Portland Monthly Top Docs awardee for his clinical excellence. Mr. President, sir, I have the great honor to present to you Professor Sanjay Krishnaswamy, so that you can confer on him the Honorary Fellowship of the West African College of Surgeons.
By the authority vested in me, by the Council, and with the approval of Fellows of the West African College of Surgeons, I confer on you the Honorary Fellowship of the West African College of Surgeons.
Thank you very much. It is now time for group photograph at the high table with His Excellency, the President of the Republic of Ghana. Thank you. Yes, past President, please. Play the processional music. Thank you.